Sometimes we find that people have an intolerance or don't tolerate bending backwards very well, especially in the lumbar spine. So, one of the things that I might have them do, if we find that that's the case, is start to get used to being in that position. Using a foam roller can be a way to kind of control that and slowly build up that tolerance over time. So, what we're going to do is we're going to place that foam roller in the low back. You're going to have the knees bent. So, this way you can really control what's happening at the hips here because you're going to gradually, as you exhale, allow those hips to sink lower and lower. The higher up in the back, the more aggressive it's going to be. The lower, the less curve you're going to create or allow. So find the sweet spot where you're feeling a little bit uncomfortable, but it's still very tolerable, and you can still hold your breath and or breathe and engage the back muscles um, voluntarily. So again, we're going to go through that breathing cycle where you take a breath in, and then as you exhale, you're slowly lowering these hips to the ground and arching even more over that foam roller. I don't want you actively pushing down. I want you really just relaxing and allowing the motion to happen, allowing gravity to take the hips towards the floor. We'll go through 4 or 5 breaths like that. Belly breath in, exhale, sink down. Take another belly breath in. As you breathe in, try not to let the hips raise up. Try to just keep them in your lowered position and then take up any more slack that you can gain with that exhale. Then, once you get as far as you can go with those 4 to 5 breaths, now we're going to engage the small of your back. So, the low back muscles, I want you to just gently tighten them. And you should feel them bulge underneath that foam roller. Again, you're going to hold that for somewhere between 5 and 10 seconds. And then you're going to exhale and see if you can lower those hips even more. Again, we want this to be very tolerable. It's going to be mildly uncomfortable, but I don't want it to be sharp, shooting, painful. I don't want pain going down the leg. So after you go through about 3 different cycles of engaging the low back and relaxing, then you can give yourself a break and give yourself some relief by placing that foam roller underneath the tailbone and allowing the hips to rock in the opposite direction, opening things up and allowing yourself to rest for a little bit before repeating and going back through another 4 to 5 breaths and another 5 to 10 second tightening of the low back and then relaxing in.